Hi, I'm Lauren Dennis. I'm one of the dietitians here at East Sussex Healthcare NHS Trust. So maintaining good nutrition and hydration is key in keeping ourselves well and supporting normal immune function, particularly so during these challenging times. At the moment, there's no evidence that any specific food, diet or supplement will stop you from catching or developing COVID-19. However, following a healthy, well-balanced diet with a variety of foods from each of the food groups should give us the broad range of nutrients that we need to maintain good health. So what does this actually mean in practice? Firstly, try to keep to regular meal times. This gives us a steady source of energy throughout the day, and it can be helpful to eat in a separate room to where you're working or spending the rest of your day. This can help us to eat a little bit more mindfully. We'd suggest that you try and base your meals on the three main components, so having a good portion of starchy whole grain carbohydrates, a portion of protein, and then 1 or 2 portions of fruit or vegetables per meal. We understand that it might be more difficult to source food, or you might be relying on others to do your shopping. Try to plan your meals in advance and consider having just a small store of frozen or tin produce, so things like fruit, veg, meat and fish. And these can be just as nutritious as their fresh alternatives. Although we should be keeping our shopping trips to a minimum, there's no need to stockpile food. We would also suggest aiming to drink 2 litres, which is equivalent to 6 to 8 cups of fluid throughout the day. It might be helpful to avoid having excess caffeine, fruit juices or alcohol. Lastly, although there's no evidence that vitamin D protects against COVID-19, it's vital in promoting good bone health and immune function. Whilst there are some sources in our diet, in the UK we get most of our vitamin D from the sunshine. With many of us self-isolating or spending less time outside, we would recommend considering a supplement of 10 micrograms per day, which is available in most supermarkets and pharmacies. For any more information on nutrition and diet relating to COVID, please visit the British Dietetic Association website.